I'm Melissa, and together with Jamie and Emily, we make the team the Northern Lights. Over the past 2 semesters, we've been building CareCompass, a patient-centered healthcare hub. Thank you for being here today, and we're excited to walk through our full journey with you. Here's how we'll spend our time together. I'll open with our intro and discovery work, who we talked to, and what we learned. Jamie will then walk through how we turned those findings into product through ideation and prototyping. And then Emily will close with our testing and iterations and where CareCompass goes from here. So let's start with the why. Patients today feel lost and anxious in a fragmented healthcare system. They battle administrative friction, non-transparent costs, complex medical jargon, and those create real barriers to confident self-advocacy. Our solution is CareCompass, a patient-facing mobile app that layers explainable AI on top of existing EMR systems. It translates clinical language, provides real-time cost transparency, and prepares patients for every stage of their visits. We gave ourselves 3 objectives to anchor the work. We wanted to restore confidence so patients feel like participants and not passengers. We wanted to establish transparency and cost, results, and what happens next for them, and to reduce the burden on patients who navigate the system as well as providers who answer the overflow. So who are we designing for? To answer that, we went into deep discovery, 35 literature sources to ground us in what was already known, benchmarking against 10 existing apps and more than 344,000 reviews to see where the market falls short. We performed 18 interviews with 11 patients and 7 registered nurses to hear experiences in their own words. After reviewing 35 peer-reviewed sources, 4 themes kept surfacing. First, health literacy. It was one of the strongest predictors of how well patients navigate and access care. Second, communication gaps between providers and patients. It drives inequity, but those are fixable with the right training. Third, recognizing health literacy is not an individual issue. It's shaped by our system and our culture. And fourth, technology is raising the stakes. As care moves digital, e-health literacy is just as critical as traditional health literacy. Our benchmarking pipeline started with over 850,000 reviews across direct and indirect competitors, MyChart, Ada Health, Mayo Clinic, GoodRx, ZocDoc, and more. After filtering and cleaning, we retained just under 345,000 reviews, a 40% retention rate. What surfaced was clear. The top priorities are health data integration, provider communication tools, and insurance navigation. And those are gaps that nobody is filling very well. Then we talked to real people. 11 patients and 7 registered nurses, all one-on-one, semi-structured Zoom interviews. With patients, we dug into their pain points, health literacy, and what empowerment means to them. With nurses, we wanted the view of the other side. What do they see when patients come in unprepared, and what does patient advocacy actually look like in practice? On this slide, I'd like to just have you take a moment to read this and let the patient speak for themselves. As you can see, there's a pattern about accessing without understanding, a fear of not knowing what the results might mean, anxiety of waiting a week to talk to someone who has to translate the results for you. This is the gap that we are designing into. And this is the nurse's side. They describe having to teach medical terminology 101 in the exam room. They are the first line of patient advocacy, and they are the ones that are absorbing the time and cost when patients arrive unprepared. That tells us that a good solution has to help patients and relieve pressure points on providers. It can't be one or the other. To validate what we were hearing, we also interviewed Dr. Runge, a practicing physician and former CEO of Michigan Medicine, where he spoke to some of the challenges in the current healthcare system and shared his thoughts on the use of AI in healthcare.
I do think that the cost is a big issue. I think transparency is nil because of the perverse way the health system billing has worked. It's most clear or most unclear around medications playing. So how would that affect what decision making? So I think couple ways. One is it could help restore trust. Right now, I feel like trust in health care providers and trust in health systems is low, much lower than it has been in the past. And I think it's because of a big part of that, this lack of transparency around costs.
Before I continue, I just want to make sure you can hear that video.
Yeah, I can hear you. Yep. Good.
Okay, thank you.
Probably from their GI specialist to their cardiologist to their mental health physician or counselor, and without really a center. And so, one of the things I started off with in the book, The Great Healthcare Disruption, had to do with an area that I think is ripe for improvement with AI, and it has to do with people having a primary care home. I strongly believe that AI ought to be able to pass muster. So just like physicians have to be licensed and you have to take ongoing medical education, whatever it is, I don't know how to test AI, but it needs to meet that threshold at least, and I think it will exceed that threshold. So we shouldn't just willy nilly be saying, okay, we'll approve every new AI innovation that comes on, but we also shouldn't be holding it to an entirely impossible standard.
So our interviews became our sanity check on everything else we learned. Synthesizing across all the data, the same four themes kept rising to the top: financial transparency, a need for trust on cost and coverage, patients not feeling prepared to advocate for themselves, the literacy gap, basic health knowledge and complex medical jargon getting in the way of their proper care, and the digital portal rabbit hole, fragmented data and results with no clear action plan. Everything we built in CareCompass maps back to these 4 points. So this is Lisa, our primary persona, a 42-year-old working parent on a high deductible plan. She is cost conscious, moderately tech savvy, and has limited medical literacy. She wants to be a good advocate for her family, but every interaction with the system costs her time, money, and peace of mind. Lisa is the user that we held in our minds for every design decision that follows. Next, I'll hand it over to Jamie.
Perfect. So once we had the problem identified and understood the user's needs, we went ahead and moved into ideation, starting with broad idea creation, thinking of something as simple as small wins to these crazy, infeasible ideas like even an AI digital twin, and narrowing it in from there to really understand what features and solutions we could provide that would help with our users' needs. So again, we started broad. Every one of us went into the Fig Jam and we tried to create as many ideas as we could, really honing in on the insights that we gained from the user research. They were very big, crazy ideas, things that have never been done in medical field before. But then also we had some really great feasible ideas too that really allowed us to hone in and focus on what we could do with today's technology and capabilities, and even emerging technologies like AI. After putting in all of our ideas, we went ahead and did a voting system and used that voting system to really show priority in what we should be focusing on based on what each three of us felt aligned most with our users' needs and problem space. So this is just working through Lisa's journey. going through not only what she's experiencing within the current state of the medical market as well as healthcare patient apps, and then going into how she feels differently with CareCompass being able to help her through the pre-visit checklist, helping her gather questions and medications, understanding what she needs to be best prepared for her visit, as well as giving it within a plain language that she can clearly understand no matter her health literacy level. Basically taking away this feeling of ambiguity and questioning and uneasiness around the healthcare journey that a person goes through. So once we went through and we saw how many different features and solutions that we could provide to help with our users' pain points, the most important thing after that is understanding how to navigate through all of that. There's a lot of features when it comes to healthcare within billing, medications, insurance, appointments, resources, the list goes on and on. But we wanted to figure out the best way, not only within each page to display the data, but also within navigation, figuring out what is the key things that people are going to navigate or use every day, like home, insurance, appointments, and records. And then understanding that we should still keep those other features easily accessible within the side nav menu. And then right here is the skeletons of our wireframes. While we did move a little bit away from some of the ideas in here, it was really key and pivotal in understanding hierarchy within breaking down font weights, information, data, and then also getting through some of the kinks, like having a floating action button for an AI. We thought it would be great, easily accessible, but it also gets in the way of some data, not only reading dates, but pushing buttons as well. And then the last important thing within our ideation phase was understanding how we could give our AI a face as a mascot to allow people to connect with the AI. AI in general is this faceless, cold thing that can be perceived really harshly depending on the space you see it in. And healthcare journeys and patient care is something that is very, very fragile, depending on the data, the personal information that you're going through, as well as certain scenarios with different types of diagnoses. So we wanted to create a mascot that made it friendly, guiding, and not as alienizing for AI, and help them guide it through. So going into prototyping, it's taking all of these ideas that we've created, the foundation work that we've made, and really starting to put the pieces together. First things first was understanding and taking those wireframes and starting to understand what would this brand look like. So we created a mini brand style guide, understanding the logos, understanding icons, and more specifically, the color. Most medical and healthcare applications use some type of blue tone, and you can go cool in the tones, but we wanted to stay a little bit more warm and welcoming, creating that calm, trustworthy atmosphere without it feeling very cold. The next thing was going ahead and creating our design system. We wanted to use an atomic design approach that would help with consistency across screens, and wanted to do something a little bit more new in the liquid glass style, but also make it accessible, which we had seen as issues with liquid glass in the past. And trying to replicate it by hand in Figma was a little difficult for us. So we actually used Claude in this instance to help prompt us how to walk step by step with creating these items within Figma and be able to learn that process as we went through. So this right here is actually one of the task flows that we tested, which was scheduling an appointment. It's often one of the first points of friction within the patient journey, and we wanted to make sure that that was something that we tested and brought ease to when it came to the traditional calling in, going through the questionnaire, putting in all of the information, where you already have your insurance connected, you're able to see your providers, you're able to pick a day and answer the typical questions that you would have to do when calling in anyway. That way it creates transparency, and you can even see that estimated cost up front with your insurance connected. Here is the post-visit summary. A lot of times people will leave the appointment asking what's next, what happened, what did we talk about? And within the appointment details, you're able to record with Scout. Scout's able to bring in all of that information once you give it permission and listen to the context of what's happening. translate it in a way that is understandable to the patient based off their health literacy levels from their questionnaire, and show that scout visit summary, the topics discussed, the medications, your next steps, and your lab orders. So then you never are questioning once you leave. The next task that we tested was the ability to find the cost for a blood work lab via the insurance. Insurance navigation and cross transparency was, again, one of the key things. So we wanted to be able to have a way where they could go into the insurance, go to a cost finder, and be able to look up blood work and understand what that would cost with insurance, typically at most places, as well as without. And then the last task that we went ahead and tested was just a general interaction with Scout as an AI assistant. Since this is such a new area, we wanted to understand how people were interacting with Scout and give them a scenario where they would use it to help them translate either a difficult term or a type of diagnosis, and then be able to continue chatting with Scout in the chatbot interface. And this is actually a live AI model that we brought in from Anthropic, so we could clearly see during testing and gauge how people would naturally respond and let them type in any prompts that they had. Here you can see that Lisa's actually asking, hey, what are the best ways that I can manage my type 2 diabetes as a diagnosis? And then once the chat is done and she enters, that is a real response that's brought in by the Anthropic Haiku model that we connected through an API. So as I alluded to, we felt that in this project, a coded prototype would be key when it comes to providing a in-depth understanding of how people interact with AI. And then this is just a quick, really cool thing that we use. We use PostHog to gather our quantitative data on the back end. That way we could really focus on the qualitative interactions during our user testing.
So for testing, we, as Jamie discussed, did some task-based testing. Next. Okay. So we had 2 rounds, 12 participants, 6 participants in each round, and 4 core tasks. We started our testing plan by discussing what we wanted to test out of it. So we did effectiveness, efficiency, satisfaction, and trust. And we based things like the satisfaction off of like different questionnaires, whereas efficiency and effectiveness were things like back button misuse or errors. And then for trust, we had a confidence question and adjusted sus. And then we did our setup was the consent and pre-task survey, demographics, including healthcare and AI experience, which was really important for this type of testing, moderated usability testing with those 4 tasks, and then a post-task survey and short interview. Our demographics ended up being really interesting and split between the 2 different testing groups. For test 1, there's an even split, but they're all on the younger side. And then for group 2, it was even split, but all on the older side of our range. Education history was another differentiator. Our first round was all post-secondary participants, whereas the second round of participants were more varied. They had a wider background. We also made sure to have that screening question where it's the most recent visit to the doctor. So all people had to have visited the doctor within the last 18 months. And then for health information comfort, we were asking questions like, how comfortable do you feel with the information you're getting from your doctor or a healthcare website? And there was a little bit more spread on the first, but higher comfort on the second group. For internet search, that was the primary way that people investigated their health questions in the first group, whereas the round 2 was more human-centered. They wanted to ask their friends and doctors. For smartphone app comfort, round 1 was highly comfortable with using smartphones and apps, whereas round 2 was a little bit more of an even split between 4 and 5, but still comfortable. And then use of AI tools. Round one was frequent AI users, whereas round two had rarely or never used AI. And then, as I said earlier, like round two had never used AI for health, 100% no. But then round two was a little bit more open, some already using it. So for task one, we had that scheduling an appointment flow. The round one, the average, wow, the average question score was a 6 out of 10. And then for round two was a 5.8. For the post-visit summary, content was right, but location wasn't. Users couldn't find what they needed. So for round two, we had 5.3, and then it went up to 6.0 after we did our round one iterations, which I'll discuss after this. Task three ended up being the one that was hardest for both groups. It was 4.6 for round one, 4.3 for round two. But users expected the cost finder to be inside of insurance and not its own destination. Yeah. And then you can continue on. And then for task four, using Scout as an AI assistant, both felt it was a 5.2, and it was also the longest task time that we had. We had really small adjustments, but they were driven by that evidence that we received in round one testing. So we had this simplified explanation of benefits. People had a really hard time hitting the required area for calendar and scheduling rather than just having it be through click to schedule. We also included it on the calendar. For meds and records navigation, we relocated the navigation entries to match the mental models that users were telling us and displaying. And then cost finder linkage ended up being moved from a side menu down to that main bar. Comparing the testing rounds results, the SUS went from an 80 to a 72.8. We do believe that that is because our groups ended up being so different from each other, specifically that age skew. And then Trust and Scout stayed very strong despite that difference. Both were in the 80s. And then post-visit clarity, 5.3 to 6.0 for task two was a really big gain for us. And then the cost finder discoverability was still the hardest. Users told us what to build next. They said that they couldn't really understand that the AI was supposed to be, or the AI icon we had was supposed to be Scout. They had issues with medication navigation and knowing where pricing would be, and that it needed to be clear. So if we did a second round of iterations, we would definitely move the cost finder to be more intuitive and upfront. Moving it above the fold would increase that visibility and engagement. We would have Scout, our little compass guy, as the AI icon instead of moving it down there. And then we would have a data layered approach. Testers felt a little bit overwhelmed by the data they could access. So we would want to have that be more progressive disclosure. And then for onboarding tips, that would be moved through. It's okay. And then our conclusion. So for future iterations, yeah, our biggest three things that we would continue would be the idea of a caretaker review. It was something that we were asked about a lot, was whether or not you as like a parent could take care and manage your family's medical information. And then a customizable dashboard so that users could pick what was there and hide what they didn't want, and deeper EMR integration for the provider experience. And then what we're carrying forward, testing flexibility based on participants. The way that our demographics skewed really ended up adjusting our idea of how that should go forward. So we really want that to be adjusted. A coded prototype with real AI definitely teaches you more. So testing against a live Scout was really important, and it ended up being really great for us. Accessibility and health literacy are constraints, not add-ons. So they shaped everything that we did. And our biggest takeaway has kind of been that we've barely scratched the surface. This was such a huge problem that we worked on, and it'll be a constant battle to like try to reiterate on that. And then we just wanted to send a special thank you out to Dr. Kim, all of our classmates, all of our family members for all the patience and guidance you gave us through these 2 semesters. We really appreciate everything.